Hi, I'm Caroline Peacock with Winship Spiritual Health.
Hello, I'm Wendy Bear. I'm a psychiatrist here at Winship Cancer Institute at Emory University in Healthcare. Caroline and I are here today to talk about stress related to the COVID pandemic. We want to be as helpful as possible. We have some questions for each other, which we think that folks that we take care of here at the Winship Cancer Institute may find value in hearing. So Caroline, would you like to start with your questions?
Yeah, I'd love to be able to ask you some questions. So, Dr. Bear, the first question I have for you is I noticed it looks like you're in your office. Is that safe?
Yes, I am here today at Winship, and I have set myself up to see patients virtually over the app that's called Zoom. I'm also here looking at patients' charts, answering electronic messages and phone calls. I am calling people back and filling prescriptions for people who will need those. Winship Cancer Institute is open to take care of people who have cancer. We're being very careful to take care of people who are in active treatment right now. We're being very careful to screen people coming into our buildings to make sure that they're free of fever and cough. If they do come in with fever and cough, we're being very careful to make sure their needs are met, but in a safe way for them, the other patients, and our doctors, nurses, and other healthcare professionals.
Can you tell me a little bit about what you want your patients to know right now about staying well?
Well, thanks for asking, Caroline. It's really hard to feel like things are okay right now. I mean, for any of us, these are incredibly difficult times, ones that none of us have experienced before, where bars and restaurants and public spaces, schools and businesses are closed or asked to stay home for days on end. We don't know when life will get back to normal. So I think that we need to be aware that it's unsettling and be able to talk about the reality that these are unsettling and scary times. I think to stay well is to try and stay as well as possible, to work really hard to shift your attention to what is working for you. I mean, is your family home? Are you able to call them on the phone if you live at a distance? Are you able to get on your computer? Are you able to write a letter? Are you able to take a walk outside? There are some things that you're still able to do, and I think that can help us feel a little bit more grounded, a little bit calmer if we're able to shift our attention to what is possible right now.
Thank you so much. I'm wondering what you think families should work on to support their loved one who might be going through cancer treatment at this time.
Like I mentioned, Winship Cancer Institute is here. The teams that want to beat back cancer, that want our patients to do as well as possible, are here and still focused on taking care of the needs of our folks who have cancer and are in treatment. I think that folks who have been in cancer treatment already know quite a lot about infection control. They already know the importance of washing their hands, not touching their faces, avoiding people who have a fever or a cough. We already know about minimizing our risk of infection when we work in healthcare or we're a patient in treatment. So we really need to double down on that skill set of minimizing contact and practicing social distancing to keep ourselves well.
Thank you. I'm wondering what people should do if they're feeling especially depressed or anxious at a time like this.
Yeah, I think that this can be enormous triggering event for people who have already been diagnosed with clinical depression or an anxiety disorder. This sort of magnifies our underlying sense of being out of control, of wondering what's next, certainly feeling like everything may fall apart. Again, if you've been in treatment for depression or anxiety, the things that you've learned either in talking therapy or the things that you've used, maybe medications or stress reduction skills to quiet your mind and quiet your body, those are more important than ever. So really take a look at what your coping strategies have been before that have helped you, and try and employ those right now. Take a close look at your thoughts today or your behaviors today, and make sure they're ones that are keeping your energies up or keeping you moving forward. Certainly there's coping strategies that are less helpful than others. Getting really irritable or judgy or lashing out at friends and family is less likely to help you right now. People who have a tendency to cope with alcohol and drugs may want to be very careful about their substance use right now. It's a difficult time, and we need to look at the things that help us quiet down, skills and mindsets that help us keep going, and that are useful right now. Which actually makes me think, Caroline, about a number of the skills that you work with people, patients and family members on day to day. Can you talk a little bit about some of the skills that you employ in your work day to day that may be especially useful now that we're all stressed with the COVID pandemic, the social distancing, and the changes in our schedules?
Sure. In the spiritual health practice, what we want to do is we want to support people in their moments of distress. And of course, this is something that we're doing all the time because people living with cancer and their family members are often in distress. And with this pandemic on top of that, as you mentioned, the distress can be even more. So what we're doing right now, we have spiritual health clinicians across the Winship campuses. What we do, and throughout our hospital system, what we do is we offer care to patients and families where we listen to what they're going through. We, when people are experiencing any kind of feeling like anger, fear, anxiety, sadness, we want to communicate to people that those feelings are normal, that it's okay to be feeling those things. And sometimes simply having someone acknowledge that it's okay to be feeling what you're feeling can bring a discernible sense of relief. And then what we want to do is we want to support people in the spiritual resources that they have. So for example, if somebody has a particular spiritual or religious practice that is very calming and soothing and grounding for them, we want to encourage people to engage in those practices regularly. We want to encourage people to be connected to the things that give them life. If that's talking to people that they love, listening to music, stepping outside, getting a breath of fresh air, those are the kinds of spiritual resources and practices that we want to support people during any time, but especially at a time like this.
I'm really glad you said that, Caroline, about people talking about their feelings. I think that sometimes folks who aren't used to that can minimize the value in talking about your feelings. I think that with job insecurity, financial pressures, difficult relationships that now are even more difficult because everybody's stuck at home together, that you might think, why talk about this? What good is that going to do? How is that going to change anything? Although we know when people are able to talk about what's going on, they can take the next step, which is figure out what to do about it. When you get to talk about your feelings, you can maybe manage them and work on changing the internal state of your mind and your body, because obviously, as you and I know, your mind and bodies are connected, and you're gonna feel worse. Your pain symptoms are gonna be worse. Your fatigue is gonna be worse when your mind is distressed.
Yes.
The other thing I think that's so valuable in talking about your feelings is it gives people a chance to avoid acting on their feelings. You know, when any of us are upset, you can imagine in the old days when we were driving around, you get tense, you feel pressure on the road, and next thing you know, you're honking at the person in front of you. If you can maybe talk through your feelings, be aware of your feelings, you're less likely to press on the horn. And that may be true for a lot of things, at home, with family, with children who are out of school, and really pressuring parents right now with their virtual learning, if they're even doing that or able to do that, that we want to be able to have a little more time before we act. So when we talk about our feelings, it gives us a chance to consider what we want to do next or say next, before we go ahead and honk on the horn, so to speak.
Yeah, and I think just acknowledging how hard this is for
Yeah.
many people is really important. So what I always like to encourage for other people, but also for myself, is to have patience with myself and kindness toward myself during times like this. When I feel like, oh, I'm so mad at myself for getting mad at a family member or becoming impatient, I like to just try and say, I'm doing the best I can right now.
Yes.
And to, in this really hard time, to just be patient with myself and kind with myself. Sometimes I even take my hand, I put it on my chest as just a reminder of, be nice to yourself, Caroline. And it helps. It's very simple, but it really helps.
I agree with you, and I so appreciate the 3-minute video you put out on YouTube, guiding people through a compassion meditation. I encourage all our patients and families to look into resources related to self-compassion, compassion-based meditation. Even if you've never done it before, if this is the first time, I mean, why not try? 3 minutes is not a long time. Trying to catch your breath, trying to take a moment out of your looking at social media or looking at the news or getting updates from people around the world right now, taking that break to catch your breath and check in on the messages you're giving to yourself. How you're talking to yourself will really influence your mood and probably influence your actions.
So let me ask you, Dr. Bear, can you tell me if somebody really is in crisis, what can they do? Is there anyone they can call?
Yes, and thank you so much for asking. Phone calls are safe. Phone calls are okay. Please have some patience and compassion for the people who are answering the phone. There are a lot of messages coming in to Emory Healthcare and to the Winship Cancer Institute, and our medical assistants and phone triage people and schedulers and nurses and doctors are all trying to answer the messages as quickly as they can. If you are in very serious crisis, like you have thoughts about hurting yourself or hurting somebody else, in Georgia, you can call the crisis line, which is 1-800-715-4225. If you live outside of Georgia and you're in very serious crisis from a mental health perspective, you can call 1-800-273-TALK, and that's the National Suicide Hotline. You can always call Winship if you're a patient here, which is 404-778-1900. And I know our portal team, if you're doing electronic messages, is actively reading messages and actively trying to return messages as soon as possible.
Well, thank you so much, Dr. Bear. And thank you to everybody for watching this. We care about how you're doing, and don't hesitate to reach out. Thank you.
Bye.
Okay.